I'm here with Kay Hyman, the Chief Executive for the Nepean Blue Mountains Local Health District in New South Wales. Kay, thanks for making time to speak with me today. And we're now at day 3 of your inaugural conference,
Yes.
Together Achieving Better Health. And so far, all of the reviews from people has been a really, really well put together and stunning conference. So congratulations to you and your team.
Thank you.
What was the thinking behind it? Obviously, you're a big, complex district. You're busy. You've got a lot of stuff happening all of the time, and you've got a big investment coming your way for a new health precinct. So imagine you didn't have a lot of time on your hands to be thinking, let's have a conference as well. But clearly it's been important for you as Chief Executive and your team. So what's the thinking behind it?
Okay, so the thinking started about 18 months ago, so before we had the certainty of the announcement of the redevelopment. And I felt it was time that we had a bit of a coming of age and started to talk about some of the things that we're doing, because quite often I would have staff come back from other conferences and say, oh, so-and-so presented about something and we've already done that, or there was an idea that was purported to be new, but it's something we did a long time ago.
Yeah.
So I think we got quite good at doing things, but not necessarily telling people about what we were doing.
Yeah. And I've been really interested in the way, I guess, then you've constructed the program. There's been an interesting set of themes that are running through the conference. So can you say some more about that, about how you wanted to position the conference?
So having had the idea 18 months or so ago, obviously since then we've had the announcement of the redevelopment and many things that are changing the course of the organisation as we go forward. So I thought it was an ideal time to think about the things that actually matter to us and certainly matter to patients, so that as well as building $1 billion worth of new building, we move into that new building with new ways of doing things which are really partnering with patients and their families in different ways. So we deliver a new health service in a new building.
Yeah, and some of the theme has been about the person and the patient at the centre of all you do, and also compassion and compassionate leadership as well. And we've seen some examples where health can be tough at times, and sometimes the compassion part gets a bit lost in the noise of all of that. So that's clearly been pretty important for you and your team as well, to be amplifying that message through the conference.
Absolutely, and I think one of the things that's relatively special about Nepean Blue Mountains is the size of our workforce compared to the size of the community that we serve. So we've got about 5,500 staff, of which nearly 90% live locally, and those that don't live locally live just outside, generally, the local government areas that we serve. And I mean, if you think about the Penrith area where we are today, population of 375,000 or so. So the chance when you take our workforce and you multiply those by family and friends, the chance that you're actually going to be caring for somebody that you know or somebody that you know knows is much higher than if you're in a major metropolitan inner city hospital. So I think that compels us, and it certainly compels me and my senior team to value even more compassion, because it is the community that we serve, and chances are we're going to know the people that we're providing healthcare to.
Yes, that's right. And you mentioned, Kay, that the district is going to enjoy considerable new resource, and at the gala dinner last night, you talked about really making sure that resource is invested in a way that it is creating a 21st century plus model, so really looking forward. What is the current thinking about how that investment is going to look for the district?
So, with Architects Engaged, we've already got some, fly-throughs of what the building might look like. And if you look at hospitals that are built all around the world, I mean, there's some reasonably standard ways of doing that. And we probably won't architecturally look that different to many other places. But for me, what will be important is the way that we deliver care within those four walls, and that is what I hope will be different to many other places, and it will be partnering with patients and families, and it will be having the compassion that we've talked about over the last 3 days.
Yeah. And coming back to the conference itself, we're on day 3, and as I said earlier, there's been a terrific lineup of speakers, people who are here. Lots of animated conversations when people are, hanging out in the HG Chill Lounge. For you, has the conference been a success? Has it met your expectations as Chief Executive?
Yes, so you go into these things, as I said, sort of 18 months ago with an idea, and at the time a lot of the team that I brought together thought, oh, here she goes, another sort of out there idea, but we better do something about it. So the closer you get, the more anxious you get. Have you got it right? Is it going to work? So as we're sort of midday, about day 3, I'm beginning to feel a little bit more relaxed, to breathe a bit easier, knowing that everyone that's helped put it together has chosen the right people, the right topics, and it's feeling good. And I have to say, the HG Chill Out Lounge, I'm hearing lots of positive comments about. I think one of the favourite conference locations. So thank you for that.
You're welcome, Kate. And so where to from here then with the the conference?
Right, so I'm going to close the conference with a few words, and I guess in that will be some challenges to Nepean Blue Mountains Local Health District staff. I think we've heard some of those from the various speakers, and I guess Chris Bagley this morning talked to us about, hope is not a plan. So one of the things that I'll be doing with my team and the organisation broadly after this is going back and making sure that we're doing more than hope, that we're actually putting a plan together to ensure that we deliver what I'm sure we are capable of.
And next year we'll all be back there again.
Yes, I'll just leave the team a couple of weeks. We've got an accreditation survey next week, so I'll leave them a couple of weeks before I start talking about next year.
Well, congratulations, Kay, on a brilliant conference, and thanks for talking to us.
Thank you, and thank you to Hardy Group for their sponsorship. Without sponsors, we couldn't have such a great event. Thank you.
You're welcome. Thank you.